Hi, my name is Mike Russo, healthcare advocate and staff attorney with CALPIRG. Thanks for watching this briefing on our Making Healthcare Work campaign. Today, I'd like to talk about one of the ways that we can bring down the rising costs of healthcare, reducing administrative costs by setting an insurer efficiency standard. The stakes for this campaign could hardly be higher. Premiums have doubled over the last 10 years, and without real reform, they're set to double again over the next 8. Now, if those premiums were all going to keep us healthy, that would be one thing. But instead, the insurers too often spend our money on pointless red tape and other administrative costs that don't actually keep us healthy. When you add in marketing and profits, you start to wonder what we're actually paying for. But there is a way to stop wondering and start knowing that we're getting high-quality coverage. That's by setting an insurer efficiency standard that would require the insurers to spend 85 cents out of every premium dollar that they take in on medical benefits. That would shift the incentives that the insurers prioritize providing care over pointless red tape. And it's easy to do too, because the insurers already keep track of this percentage, except they call it a medical loss ratio, because as far as they're concerned, providing medical care to their customers is a financial loss. CALPIRG recently put out a report that looked at the actual practices of these insurers, and we found that some do a good job of keeping those administrative costs low and providing high-value coverage. But at the same time, there are some who just don't measure up. They spend 70 cents or even less out of every premium dollar on actual health benefits. The rest gets chewed up on administrative costs and doesn't help a single patient. And the insurer efficiency standard will have a really big impact, because it means that every time the insurers are making a decision, they have to stop and think, wait, does this increase value for my customers, or is it just throwing up another pointless layer of red tape? And that has an impact on everything from improving the use of health information technology and electronic health records, to streamlining the billing forms that the insurers use, to just prioritizing prevention and keeping people well, as opposed to denying them care. Now, opponents of the 85% standard had said that it's unrealistic, that the insurers wouldn't be able to measure up. But that's the opposite of what our research found. When we looked in California, 2/3 of the HMOs that we looked at already met that 85% standard. And that includes insurers big and small, for-profit and not-for-profit. And the trend is the same when you look nationwide. 47% of insurers in other states also already met that standard. The good news is that leaders in Congress have already introduced the first healthcare reform bills, and they include the insurer efficiency standard. And here's the best part. Under the plan, if an insurer doesn't meet the standard, they need to give their customers a refund. It's a guarantee that you're getting your value for the healthcare dollars that you put in, because if not, the insurer needs to pay you back. The bottom line is that this is one of the ways that we can bring down the cost of care and make coverage higher value and affordable.